Now, the next question. The most effective and a safe way to administer the chemotherapy drugs. Some of you are going to work as the specialist nurses in oncology unit. So you must be very sure. So always it is the central venous catheter. Central venous catheter is the most effective and safe way. Now let us talk about it. You need to know a bit of anatomy to understand what we are doing when we are passing a central venous catheter. You should remember that this is the collarbone, sister. So what is this which is passing? This is typically called subclavian vein. Subclavian. Clavicle means collarbone, no? Under the collarbone it is passing, no? इसलिए इसको कहते हैं subclavian vein. So you are piercing this subclavian vein with the catheter, and then you are passing the catheter which enters into the right side of the heart. So this is called a central line, central venous catheter, central venous catheter. But one point you need to understand is the central venous catheter, this is called a non-tunneled one. Matlab, there is something called tunneled one. I'll tell you about tunneled one. टनल का मतलब क्या होता है? गुफा के अंदर से नहीं जा रहे, डायरेक्टली एक पंक्चर करेंगे सबक्लेवियन में और पुश करेंगे and it will enter into the right atrium and you can pass the things through this, right? Now, if you are planning to put a central catheter, central venous line, what are all the things that you should keep ready for the doctor to put a central line? So first, you have a needle and a syringe. This should be ready. Then there should be a scalpel which should be ready. Suppose if you have to make any incision to push the central line, right? A scalpel is required. Then what else? You need to have a sterile gel. This is the gel which is made available, right? Suppose if sometimes we pass the catheter into the subclavian vein and we'll be looking at the subclavian vein through the ultrasound probe. So अल्ट्रासाउंड प्रोब अगर इस्तेमाल करें तो जेल लगा के अल्ट्रासाउंड प्रोब करना पड़ता, इसलिए अल्ट्रासाउंड जेल should be ready, right? Then you need to have a 18 gauge catheter, right? So to introduce that, you require to have a introducer needle which should be available. So this is the, remember, this is the needle. First with the needle you have to make a puncture and then push the catheter, right? So you need to have this introducer needle and it will be of how much gauge, sister? 18 is what you need to remember. Then you need to have a guide wire. So this is the guide wire that you are having, right? This is the guide wire. And there is a tissue dilator. This one, when you are passing the catheter, you need to have something to dilate because tissues will apply pressure, no, when you are trying to pass it. So for that you require this tissue dilator. Then you need to have an indwelling catheter, which you are able to see. This is the ultimate catheter which is going to go inside and remain inside for a long time. So this is the indwelling catheter. Then you need to have surgical thread. Agar the point where you are puncturing the subclavian, there you have to put sutures, means you need to have the additional fasteners and surgical thread, and you need to have the dressing which should be available. So this is how the tray for the placement of the central venous catheter is made ready right now. So this is a classical example. You are able to see two lumens, and this is the place where the jugular vein, you have gone into the jugular vein, and in this case jugular, and we did not enter this guide wire in the neck, rather we created a tunnel. एक tunnel create करके under the skin, you passed through that tunnel and then inserted it into the jugular vein. So for this we use a special type of catheter which is called Hickman's catheter. What is that called, sister? Hickman's catheter is what you should basically remember. So central venous catheter, Hickman's catheter, is a tunneled catheter is what you have to basically remember. Now this is how you should have a clear idea on the anatomy, how it is basically passed, right? Now, so you have a central line inserted into the chest and the line tunneled under the skin, it can be, and this is the line which comes out if you happen to use a tunnel, skin tunnel, to push it, and finally it enters into the right side of the heart. So this is another example of the catheter with a tunnel. Hickman is what you are able to see here. Now, what are the scenarios where you want to use central venous catheterization? Central vein. What is the other type of vein that you have? You have peripheral vein. Peripheral vein. Peripheral vein. आपके elbow, the brachial vein, cephalic vein, जो हम regularly डालते हैं उसको peripheral vein बोलते हैं. ये जो subclavian vein, jugular vein, इसको कहते हैं central vein. So what is the purpose of putting a central venous catheterization? Why do you want to put a central venous catheterization is the favorite question of the examiner. Suppose you want to monitor the central venous pressure. You need to put a catheter. Similarly, you want to do pulmonary artery catheterization and monitoring. So now you should know a bit of anatomy of the heart. So you have a right atrium, then right ventricle, left atrium and left ventricle. So right ventricle से निकलेगा pulmonary artery, left ventricle से निकलेगा aorta. So what is draining into the right atrium? Superior vena cava and inferior vena cava. These two are the major blood vessels which are draining into right atrium. So superior vena cava is bringing the blood, superior vena cava, and draining into the right atrium. So whether subclavian vein or jugular vein, they all ultimately enter into the superior vena cava and enter into the right atrium. So if you are passing the catheter, central catheter, it is entering right atrium, from there it enters into right ventricle, and from there it will enter into the pulmonary artery. So that is the reason pulmonary artery ko agar if you want to catheterize, you need to approach through central venous catheter is what you have to basically remember. Right. So then if there is any hemodialysis you are planning, temporarily you need access to the blood. So hemodialysis ke liye. Any chemotherapy, this is what AIIMS examiner is asking. Chemotherapy may hyperalimentation. Suppose somebody is not able to eat food orally, then they need to be given nutrients through the central venous line. So hyperalimentation ke liye. Then if peripherally if you give certain medicines, they will irritate the blood vessel. such things need to be given, such kind of medicines need to be given central venous line. Suppose if somebody has a prolonged antibiotic therapy, for example, endocarditis, heart has valves, right? So valves can get infection, that is called endocarditis. अगर endocarditis हो गया तो इनको 6 weeks, 8 weeks, 10 weeks you have to give the antibiotics. For that also it is an indication for central line. Then they are the main things, at least for now, you need to remember for the tomorrow's exam.